Hi everyone, I'm glad you're here. Thank you very much for joining me today. I want to thank all of you that have supported me on either PayPal or Patreon or sent a super sticker here on YouTube. Thank you. I also want to quickly mention that you'll probably hear my washing machine going in the background. Yep, laundry day. A third human tested positive for the avian influenza or bird flu in China and later died last month, according to a CDC report. This is the first reported death from the virus, and the other two infected people were also in China and tested positive in 2022. Both of those cases were young children. If you're not subscribed, please subscribe, and please thumbs up my videos. That will help with the ranking here on YouTube, and make sure you're still subscribed. For some reason, the AI sometimes mistakenly, that's what they say, mistakenly unsubscribes people from your favorite channel. Why is it all these viruses, most of them, are coming from China? The patient was an adult with multiple underlying medical conditions from the Guangdong province who became ill on February 22nd of this year. They were hospitalized with severe pneumonia on March 3rd and later died on March 16th. Yeah, another case where someone who had underlying health conditions, probably someone who was elderly. At least this time they're not saying it was someone that was very young, which they happen to do with a lot of these outbreaks. Previously, 2 human infections of the H3N8 virus were reported in China during last year. Now, the H3N8 viruses are a different influenza, a virus subtype and unrelated to the H5N1 virus, currently spreading among wild birds and poultry in the United States and globally. What is currently known, they're saying that this human case of H3N8 virus infection is not thought to pose a risk to health of the U.S. public, air quotes, at this time. A little bit of history about the H3N8 virus. It was first detected in wild birds in the 1960s and have been detected in other animals. H3N8 virus has been sporadically detected in poultry in China, and some have been found to be genetically closely related to human cases reported last year. The USDA hosted a stakeholder roundtable discussion, evidently on Friday, where department officials said they are testing 4 bird flu vaccines as part of its no stone unturned fight against the virus. Preparing, which, makes you wonder. Or will they sometime down the road make an emergency declaration and put it out with limited testing? I certainly hope this bird flu vaccine doesn't cause strokes or blood clots, a raised risk of heart attacks, things like that. The department will be testing 1 vaccine from Zoetis, 1 from Merck Animal Health, and 2 from the USDA's Ag Research Center. Well, maybe they're going to put it in the food for the animals to eat. I have heard that they're considering that for chickens and cattle and pork. Zoetis claims it has already delivered its vaccine to the USDA stockpile in 2016 after a bird flu outbreak in 2015. However, the company says USDA never tapped into the stockpile. How would they know unless they were told? Beyond vaccine trials, USDA previously established bird flu controls that include commercial bird tracking, disease surveillance, documentation of domestic and international trade, indemnity payments, education and guidance on cleaning, disinfection, and disposal. According to a statement from the Guangdong Province Center for Disease Control and Prevention, The third human infection with H3N8 virus occurred in an adult in China who reportedly had a history of exposure to live poultry and wild birds, which have been observed around the home. An investigation did not find any additional human infections. According to a report from the World Health Organization, environmental samples were collected from the patient's residence and, I'm doing air quotes here, the wet market where the patient spent time before the onset of illness. The results of testing showed that the samples collected from the wet market were positive for influenza A. Officials in China believe the risk of the virus spreading further at this point is low. So keep those airplanes coming in. Both of the human infections with the H3N8 virus were reported in 2022 were in children. The first infection was a child who had exposure to backyard chickens and wild ducks in April of last year. The patient became critically ill and was hospitalized for their illness. The second infection occurred in May of last year in a child who visited a wet market where live poultry were present. That child had mild symptoms. All close contacts of the first two reported cases tested negative for influenza A virus, and both children recovered. H3N8 bird flu has never been detected in the United States in people. However, H3N8 virus of a different genetic lineage has been detected in U.S. wild birds and some mammals in the past. In 2011, there was an outbreak of the H3N8 virus among harbor seals in New England that caused the deaths of 162 seals. I think, I could be wrong, but I had heard reports of seals just this last year. Currently, the CDC does not recommend against travel to any country due to bird flu viruses. CDC recommends that travelers to countries and states with bird flu outbreak in poultry or people do the following. Do not visit poultry farms, bird markets, or other places where live poultry are raised. Keep or sold if possible. Do not eat raw or undercooked poultry products, and wash your hands after touching uncooked poultry. Practice good hygiene and cleanliness. Yeah, wash your hands often. Visit a healthcare provider if you become sick during or after travel. So is this the first death? I don't know. What are your thoughts? Yeah, please comment down below about this. Yeah, once again, a wet market is mentioned. And yeah, someone that had health problems. Thank you for watching. Thank you for your support. Please stay safe, and I'll talk to you later. God bless you. Bye.